So for our right side glide and standing, we're going to be thinking about a kind of a shear motion between the rib cage and the pelvis. So we want to see more of a shear kind of coming across like so, as opposed to a side bend coming through that way. So we can have our feet a little wider than normal, so we have a nice good base so we can move across the protruding arrow, and we try and move it'll be a little bit tougher. We have a nice good base. We can put a hand on this hip and a hand on this rib to help us kind of shear across. So we want to think rib cage here, pelvis here, shearing motion going through, as opposed to side bend motion, which is just going to feel a little bit differently, and we're going to close down a little more rather than get that translation and also the bottom up aspect from sort of the pelvis up getting into it. A couple of variations we can put into this is a side glide then extension at various different marks along there, and also sometimes an extension and then a side glide, or even some flexion and then side glide, depending on what we determine during your exam that would help you. So please follow along with those things and whatnot. So hope that helps, and have a good one.